Well, hello, everyone, and welcome to the series Viewing Multidimensional Poverty from Many Angles, coming to you from Oxford University in Oxford, George Washington University in Washington, D.C., and the United Nations in New York City. I'm James Foster, the Carr Professor at the Elliott School of International Affairs, joining you today from a crisp and snowy London for the sixth installment of our series, exploring advances and new applications of the Multidimensional Poverty Index, or MPI. Joining me today, as usual, is Jacob Dirksen of the Oxford Poverty and Human Development Initiative, or OPHI, and accompanying him is an in-person audience in the Department of International Development in QEH, Queen Elizabeth House. Along with our colleagues at the Human Development Report Office of the UNDP, we're pleased to offer today's presentation, Multidimensional Poverty Dynamics in Indonesia in the Time of COVID-19, Lessons Learned and Policy Implications, featuring Putu Natih of FEB Universitas, Indonesia, and the University of Oxford, OPHI. Bu Putu, it's very nice to see you again. We also welcome Dr. Dewa Wisana, also of FEB UI, who will provide the discussion for today's event. Welcome, Pak Dewa.
Thank you, James.
In just a moment, I'll call on Jacob to provide an introduction for the series and today's speakers. But first, I'd like to thank the sponsors of the series, IIEP at George Washington, OPHI at Oxford, and HDRO at the UN, for their continued support and for sharing the power of measurement as a tool for addressing the needs of the poor. Last week, we were joined by friends from Luxembourg Income Study, Piotr Paradowski, Jörg Neuschwind, and Heba Omar, who explained a new approach to measuring risk of poverty using income, wealth, and employment data within the MPI's multi-dimensional framework. OPHI's own Fanny Kovesti provided commentary on their novel approach. Next week in this series, we'll have a special online-only presentation by Mariama Santos of Bahia Blanca in Argentina, who'll present her work with Nordella Stig entitled Counting and Accounting, measuring the effectiveness of fiscal policy and multidimensional poverty reduction. Please join us then, but if you happen to miss an event, you can always find a video on our YouTube channel, IIEP GW. Now over to you, Jacob, for an introduction of the series and today's participants. Jacob?
Thank you very much, James, and welcome from Oxford to everyone in Oxford and online, wherever you may be. Thank you for taking the time and joining us for this wonderful seminar today. We, as co-hosting institutions here at the Department of International Development in Oxford and from the Oxford Poverty Human Development Initiative, together with the Human Development Report Office and United Nations Development Program, and the Institute for International Economic Policy at George Washington University, are jointly hosting this seminar series on multidimensional poverty measurement and applications. And we try to bring together academics, policymakers, international organizations to think and learn more about both methodological improvements and applications of multidimensional poverty indices. You will also find online a playlist with all the past seminars, both from this term and last terms, in case you have missed them. And we're extremely privileged to have with us today two colleagues from Indonesia who are going to talk to us about decades of multidimensional poverty dynamics, lessons learned, and policy implications. So first of all, it's my great pleasure to introduce my very dear colleague, Dr. Putu Natih, who works with us at OPHI in our outreach team and is also, as James already mentioned, a lecturer at the Faculty of Economics and Business at the Universitas Indonesia, where she teaches econometrics at undergraduate and postgraduate level. Putu is joining us from Laos today and is also supporting the coordinating Ministry for Human Development and Culture in Indonesia as a social protection specialist, and she's currently off on official duties. So we're extremely grateful that she still made the time in a busy schedule to join us today to deliver the presentation. Putu also did her DPhil here in Oxford and has been working with us ever since. Then we are extremely delighted to welcome Dr. Dewa Wisana as a discussant today, who will provide some expert remarks on the paper that Putu is going to present. Dr. Wisana joined the Faculty of Economics and Business at the Universitas of Indonesia in 1999 and was the Associate Director of the Lembaga Demografi from 2016 to 2021, and is currently the Director of Makara UI Academy, with research interests ranging from household economics to the economics of migration, population and labor economics, as well as monitoring and evaluation, impact evaluations, and randomized controlled trials. He received his PhD in economics from the Australian National University. So we're extremely glad to have two such qualified experts from Indonesia today to first present and then discuss on poverty dynamics. Before I hand over to Putu, just a few housekeeping remarks. We're recording this seminar, so anything that anyone later on in the question and answers is going to contribute to the discussion are also going to be on the record, just that you're aware of this. And then Putu is going to talk for around 30 minutes, then followed by discussant remarks from Dr. Wisana. And after that, we're going to open it up for questions and answers from the audience, both here in the room and online. If you have any questions at any point, feel free to just jot them down in the question and answer box that you will find in your Zoom window. And then we'll be able to bring you into the conversation later on. So with that, that's it for now from Oxford, I think, and we can hand over to Putu in Laos for the presentation. The screen is yours, Putu.
Thank you, Jacob. And thank you, of course, to James and Jacob both for having me. This work is, I think, far from perfect and very, very, very preliminary. So it would be, of course, really amazing to have all your comments on this piece of work. And Dewa, also, thank you so much for being with us today. I'm going to share my screen. So I'm not going to spend a lot of time on my presentation. I'm just going to probably skim through it and hopefully end in about 15 minutes to leave more time for the discussion for Dewa's comments and for questions from everyone. So I think I've made it full screen. Jacob, let me know if the slides aren't moving, but here we go. So basically this work is done in collaboration between Pak Teguh Dartanto, he's the Dean of the Faculty of Economics and Business, and there's me, and then Nathaniel, who's our research assistant. These are just really, really very preliminary results. We're really excited to share them, but I guess we should all sort of take them with a slight grain of salt, because I think the results need further analysis, definitely. So the title of the presentation today is 2 Decades of Multidimensional Poverty Dynamics and Lessons Learned and Policy Implications, particularly for the context of Indonesia. So as a background, Indonesia currently measures poverty using the consumption poverty line. That's our official poverty line. But throughout the years, so it was firstly implemented as a rice consumption poverty line, and then so a food consumption poverty line, firstly in the 1980s up until now. Throughout those years, a lot of, I guess, I wouldn't say discontent, maybe a lot of people have questioned probably the validity of this measure, because it only encompasses consumption, and the idea is, wouldn't it be better, as Professor Sayogyo, here we have him on the slide, you know, to measure poverty in a more wholesome, multidimensional way, since currently we have the statistical tools and the data to permit this sort of measurement, particularly for Indonesia, where national socioeconomic household surveys and demographic surveys are now currently held every quarter, so every 3 months. So we have the tools and we have the necessary data. So attempts by the government have also, of course, been made towards this approach to multidimensionality, started by the Family Planning Commission, who coined the idea of household classifications, so using different types of household characteristics. And then the Indonesia's Ministry of Development, or Bappenas, also has a multidimensional dashboard measure. But although sort of this discontent towards unidimensional consumption is, of course, widely known, and then although some work does exist on measuring an MPI for Indonesia, it's still sort of an under-researched topic. So we have a couple of papers talking about it, but nothing sort of really in depth. Particularly when it comes to measuring multidimensional poverty over time. So that's even less so. Even with consumption poverty, we don't really find a lot of work on dynamic poverty. Here we have Sayogyo again. I really love history, so I like reading all these old papers. In 1973, when he first thought about poverty measurement in Indonesia, he suggested we shouldn't use income, we should use something to measure actual conditions of the household. In those days, we could only do this by rice consumption. And in those days, this was already radical, but he pushed forward and then helped develop the current, I guess, food poverty line that Indonesia still uses today. So basically what we're trying to do is try to sort of push forward again. So hopefully for an improvement from this unidimensional consumption-based measure, or a supplement, for something to supplement this measure. Okay, so our objectives for this paper is firstly to measure an MPI for Indonesia using a very rich data set called Indonesia's IFLS, the Indonesian Family Life Surveys. Now, Pak Dewa here with us is the best person to comment on this because Lembaga Demografi, or the Demographics Institute, first initiated the IFLS surveys, and then through 5 waves, firstly collected in '93, and then the last wave collected in 2014. We aim to be able to see the dynamics of poverty across these 20 years. And then, of course, the next aim is to see whether Indonesia experienced progress with regards to MPI, and whether deprivations across different dimensions and indicators have improved across the years. So just a little bit about the IFLS, although Pak Dewa, of course, will be able to tell you more about this data set. So the IFLS was first collected in 1993, initiated by Lembaga Demografi at the University of Indonesia, or the Demographics Institute, with funding from the RAND Institute. It covers 5 waves, so 1993, 97, 98, 2000, 2007, and 2014, so 20 years, so quite a big time frame. It, however, does not cover the whole of Indonesia. When it was first fielded, it only covered 13 or 83% of the population in 13 provinces in Indonesia. These provinces were selected to reflect the diversity of the nation, and also, if you read the metadata for these surveys, they're very honest. One of the other considerations was cost. Indonesia is so big, it was very hard, of course, to develop a very in-depth survey and a panel data survey that could cover the whole of Indonesia. So, and the attrition rates were particularly low across the 5 waves. So they managed to recontact and resurvey 92 to 95% of the original household or household members from the first wave, from IFLS 1. And that's because they kept a really great record of where these people were, if they moved, where they moved to, and they followed them to where they moved. I guess the main weakness of this data set is that it is not nationally representative. It's only representative of 83% of the population in Indonesia in 1993. But it has many strengths, which is that it has a lot of variables you can work with and a lot of household characteristics, whether individual, household or community level characteristics you can work with. They also have retrospective data and current data. So it's a really, really rich and in-depth survey. And because of that, it took, well, me ages to understand it and to merge all the different modules together. So hence this very preliminary work we have today. So basically, the first thing we did was try to construct an MPI using IFLS data with indicators and variables that were available across the 5 waves and that were asked in the same way. So the questionnaires were given to the same individuals or the same individual age range, and they were given in the same way, or they were asked in the same way. So the aim was to preliminarily create an index based on the global MPI. So with 3 dimensions, which is education, health, and living standards, and indicators that try to mirror the indicators that the global MPI has. So we have years of schooling, which is very similar to the global MPI, and school attendance. The tricky bit for Indonesia always is the health dimension. Even for the global MPI, Indonesia's DHS or Demographics Health Survey does not have data on nutrition. Now, the IFLS does have data, anthropometric measures, it does, but I tried sort of looking at the distributions and they seem a bit wonky, so I didn't include those calculations in these findings, but I will sort of like look at the data again and examine it more closely to see whether we can use that data. And these are some of the health indicators that are available for health that are in the data set that were surveyed across the 5 waves, so across those 20 years. So there are indicators on illness for adults and children, and then access to modern healthcare if they are ill. So we try to use these indicators. There's also child mortality. So the experience of child mortality during the survey years. I know maybe James and Jacob and everyone would have maybe particular comments on whether these indicators might be problematic, I guess, in an MPI measure. And I would, of course, be very grateful for these comments. And then the IFLS also has an indicator for health insurance. So, and that's something that's quite important for Indonesia. Technically, it also has an indicator or measurements of access to healthcare, i.e. by the distance from a household. So maybe that could also be a possible indicator. But for now, we use these indicators in this current measure. It's not perfect, but these were what we found that we could track across the five waves. And then for living standards, we have, similar to the global MPI, electricity, and then drinking water, sanitation. And then the IFLS collected a lot of data on sanitation, including waste disposal, household waste disposal. And then we also have housing quality, roof, floor, and walls. And then small assets were quite problematic across the 5 waves, but across the 5 waves, they collected data on big assets. So we thought we could possibly include this for the time being, that is. the idea was to create an MPI based on the Alkire-Foster, using the Alkire-Foster method, and then based on the global MPI, so having 3 dimensions and using equal nested weights. So each dimension will be weighted equally, and then each indicator within dimension weighted equally also. And then, I mean, something different that we did was use different K cutoffs. So this is what Putu Natih, so the main author of this paper, did in one of his papers published in 2020, which was define different what he called welfare classifications using different K cutoffs. So so again, of course, a lot of you might have arguments with regards to these different K cutoffs and why the non-poor is classified with this K cutoff and near poor this K cutoff. So we're currently just using the classifications that Putu used in 2020. So the idea is, because we have panel data, it would be interesting for us to see whether people who were non-poor in one year then moved to near poor or moved to poor, or whether people in extreme poverty then ended up being able to graduate to being non-poor. So that was the idea with using these different K cutoffs. So here we have some preliminary results. I'm sort of moving through these slides pretty quickly. Let's see how many, I'm not sure how long I've taken, but here we have some very, very preliminary results across the 5 waves. So from 93 to 2014, we see that, I mean, significantly those who are in extreme poverty with a total weighted deprivation of above, so they're deprived in more than 50% or more of the weight of the weighted indicators. It lowered significantly from 67% to about 20% in 2014. So that's like a good message. But then if we look at the poor people in the poor category, it seems like they've increased from 29% to 51% in 2014. So, if we look at non-poor, it seems like more and more people have moved towards the non-poor category, which is a positive message. But then more and more people have also moved from 93 to 2014 to the near poor or vulnerable to poverty category. So, okay, 15 minutes. Yep, thank you, James. So, and here we have the poverty spells. So using the poor category, so a K cutoff of, let's go back, of above or equal to 33% deprived weighted indicators, but below 50% deprived weighted indicators. We see that almost nobody in the survey sample never experienced poverty across the 5 waves, and a staggering 63% experienced multidimensional poverty in all the waves. So these were people in chronic multidimensional poverty. And here we look sort of deeper, looking at those who are in extreme poverty, whether they've moved to the different categories or whether they start graduating. So people from extreme poverty, 93, well, 25% of those in extreme poverty in 93 stayed in extreme poverty, and 55% sort of slightly improved to being in the poor category, and then 13% to near poor, and then only about 7% graduated to being non-poor. And people in the poor category in 93, for those people, about 20% graduated to being non-poor. So this is kind of just the tip of the iceberg of what we could do with the IFLS data and what we could analyze. So here we're looking at different types of indicators, and for people who are in extreme poverty and then who graduated to being in the poor category in 2014. Deprivation in each indicator seems to have subsided, but it seems like years of schooling and then adult illness, health insurance, and waste disposal are sort of the main sort of indicators that continue to plague, I guess, people who are experiencing poverty. So the same sort of picture is here when we look at people who were firstly categorized as poor in 93 and then sort of well, not graduated, but improved to being vulnerable to poverty in 2014. It seems like years of schooling is still, and then although in 2014 it significantly declined, the deprivation in years of schooling, but adult illness is still something of is a major issue. So that's sort of a very sort of whistle-stop tour of the work that we've done. The bulk of the time that I've used, I guess, in this analysis is to understand the IFLS data set. So I'm only able to give you sort of the tip of the iceberg with regards to what we can do, I guess, with this very rich data set. But we have some very preliminary conclusions here, which is that Indonesia is experiencing progress, particularly in lowering extreme multidimensional poverty levels. But that progress is not seen when we look at the poor category. Even though there is progress, multidimensional poverty seems to be lowering slower compared to when we use consumption poverty data. So that's another significant thing that the government needs to look at. We could be doing okay with regards to consumption poverty, but if we dig deeper, there are other things that affect people's lives that we need to look at, basically. With regards to people who are in chronic poverty or chronic multidimensional poverty, so they were in the poor category across the 5 waves. So above 60% experience chronic poverty, which is a really high number, and close to 0% or 0.56% of the sample were categorized as non-poor in all the ways, so only below 1%. And then we sort of started discussing together what the policy implications were, even though, of course, the results were still very preliminary. But we found that there is indeed a real high urgency for Indonesia to supplement its consumption measure with a multidimensional measure, particularly as we face more and more challenges. For example, the pandemic, and households face different types of shocks that can affect different aspects of life in different ways. Another thing that's really urgent, I find really urgent, is the fact that Indonesia agreed to achieve and to fulfill the SDGs. It's now in 2023. We only have another 7 years until 2030, and we currently do not have a multidimensional index, an official national measure. And how can we start to measure progress, as Professor Sayogyo said in the 1970s, if we don't even have an index to measure multidimensional poverty? So basically, our recommendations is for the government to consider this measure to supplement the current consumption measure. So I guess that's it from me for the time being. Hopefully there will be developments in this research work, and I'm looking forward to hearing comments from Pak Dewa, from James, from Jacob, and from everybody here. Please give me criticisms and comments and tips to improve the work that we're doing. Thank you so much. Over back to you, Jacob.
Thank you very much. I'll just hand it over immediately to our discussant, Dr. Dewa Wisana, for his remarks.
Okay, thank you, Jacob. Asking for permission now to share my screen. Yeah, okay, so, and thank you, Putu, for the presentation. And of course, I guess I will not make any comment in terms of the MPI that technique at much. I'm still learning from Putu actually about this technique, but Putu's request actually to me, it's about the IFLS data. So I'll try to put some advance on this topic or this idea. So as per Putu mentioned in about the data, yeah. So, but first about the study, why the study is interesting to me actually this because we always, interested and curious about the new poverty measure in Indonesia because the governments, the academia, society here is always like having a positive debate on how to understanding about the poverty in Indonesia. So, and the most interesting part about this study actually we are using the longitudinal data, yeah, the most rich data that we have in Indonesia Family Life Survey. It was initiated in the first 2 waves by my institute, current institute, Demographic Institute, in 1993 and 97. And then after that in 2000 and then 2007, and the last one is 2014. It was conducted by our colleague who are split into a different institute. So they create specific institute to be able to run the survey more efficient, called Survey Meter. So they are continuing this activities, collecting the data of the IFLS. We also have another version of the IFLS. We call it the IFLS East. So it's basically cover the eastern part of Indonesia in Papua Island, yeah, because that provinces was not covered yet in the original IFLS up until now. So as I mentioned, this is a very rich data, longitudinal data. The surveyors, the enumerators actually following each individuals as well as the households wherever they go. Even if they have to cross the provinces, across islands, they chasing it. So that's why it's as also Putu already mentioned that the IFLS initially covered 83% of the Indonesian population. However, in 2014, the last wave, definitely it will be less because the numbers of population growing still quite fast. And the spreading, actually, the distribution of the population across islands also changing within 20 years. And also another features that not many people actually have time to dig further about the data is that the IFLS tend to be urban bias. Because at the time in 1993, it's very challenging, it's very difficult to reach out the rural area. So most of the location, sampled in the survey, whether it's in urban area or in peri-urban or suburban area. So the rural area is not that much because it's due to the cost, the logistic costs, transportation challenge, and so on. So that's why later I will mention as well that we may need to consider the difference of the MPI calculation between urban and rural area in IFLS, because I think some of the indicators will be vastly different compared to the urban area and rural area. So another issue here, I guess, as I mentioned here, like while the MPI is calculated at household level, but please correct me if I'm wrong, but they are also dynamic at the individual level within the household. The IFLS actually also have another ability to identify split households or new form of household. Like in 1993, there are one big family, and then a couple of children actually getting married, and they are split into different households. So IFLS have the ability to track down these families because the new household will have the new IDs, and our enumerators will ask about their condition. And basically, we can compare between their parents' household and the children's household. So, and then I guess Pak Teguh also already have some studies, yeah, to identify about the intergenerational poverty across this household with IFLS. Another aspect that also quite rich in IFLS, and I don't know how Putu and other colleagues who are expert in MPI may incorporate this aspect is the migration history. In the IFLS, there is a rich information about migration history. So we may explain the possibilities on, whether the households getting, better off or worse off due to the migration. Because as one of the indicator mentioned about the facilities or other aspects of the household, migration might explain why there is changing in household condition. Because most of the household in the IFLS, we check down whether they migrate across a different village or different district or different provinces. So we may know more or identify if there are any household members experiencing as migrant that affecting the poverty status at that time. And the last one may be about this, again, about the IFLS per se. Since Putu only mentioned 2 different ends of the IFLS, 20 years, dynamic might be due to various other things outside of the MPI indicators. For example, when we measure about the health insurance, I'm about curious why the numbers are actually a little bit small, but I guess if I'm not mistaken, in 2009, we launched our national social protection program. We call it the BPJS. So it's like the agency who provide health insurance coverage for all people. So expectedly, the numbers of those who are having this kind of insurance should be increased in 2014. But maybe the detail of the questions in 2014, they have additional questions that are not yet being incorporated here. But again, this is something that we may need to dig further, as Putu mentioned. It's so rich of information, so a different page of the questionnaires usually reveal a different information, and we need to be careful about it. So the other notes, it's hopefully I'm on a good track, trying to understand about the MPI a bit more. So I'm trying to focus on several indicators, not the dimension itself, particularly the indicators related to education and health. There are also some other indicators can be elaborated from IFLS. In terms of the education, for example, IFLS also having education history that provide a bunch of information regarding education experiences, like dropout or maybe where they got the education. And also we may proxy whether they stay longer in the school or leave the school earlier. And the other one is about health information. Putu already mentioned about the anthropometric. I agree, there are some issue on it, but the good thing about the IFLS, they also provide some options, actually. For example, like when you measure the blood pressure or the BMI, if you want to calculate the BMI, for example, they do the blood pressure 3 times. So you can use whether the median among those through measurement, or use the average, or any other approach like weighted on the average of the 3 measures of the blood pressure, for example. Another health information that may be also interesting to explore further, like the healthcare utilization. Again, in 1993 compared to 2014, there are a bunch of options in terms of the healthcare services that can be accessed by the household in Indonesia. I'm not sure, well, we can discuss in detail, but I guess in terms of the richness of this data, healthcare utilization might be very beneficial to be search further to know the changes. In the conclusion part, of course, we still we may need to discuss again, but as per mentioned, 63% experience chronic poverty or poor in all waves. This is a big number, and if the government, for example, seeing this, and if we want to use this as a what do you call it, advocacy, this is something that may be challenged first by them, and we need to provide any other comparative numbers, or at least at this point, we need to ensure which indicators actually contribute more on the poverty status. So I guess, again, the MPI have the ability to do this, and I'm looking forward to see this more. And as I mentioned about the urban bias feature in IFLS, we also may need to explore the difference between urban MPI versus the rural MPI. And also maybe there are some other characteristic or indicators that specifically for urban or rural that can be included. So then we will have additional information on whether those kind of indicators specifically explain about this poverty status between these two regions. The last one in the policy implication, I don't know, maybe we need to compare with yearly MPI if there is this kind of numbers in Indonesia. Since from the policy perspective, it is important to get attention from the policymakers at given period of time when the effect occurs after 2 decades. As I mentioned, 20 years is too long. Like on average, according to Indonesian politic system, there are 4 regimes already changes if we measure it. And people may easily get into the debate which presidents actually causing this kind of issues, like 60% of chronic poverty. And MPI should be able maybe to provide more information about how actually this dynamic of the poverty within 20 years, regardless who in charge in the palace, that explain with what kind of people stay in poor condition and which one actually getting better off. And yeah, I guess that's all from my side, and I'm looking forward for the discussion maybe about the IFLS or about the MPI. I'm looking forward to hear more and listen this kind of topic and method further. Thank you very much, Putu, and thank you very much, James and Jacob.
Great. Well, thanks a lot. We really appreciate your commentary, Bhakdevam. I'm going to turn it back to Putu now to respond to some of the discussions. And while she's doing that, anyone who's might have some questions about either the MPI in general, the MPI in this context, or the data here, please feel free to formulate them in the Q&A part of this Zoom presentation. So all over to you, Putu.
Thank you so much, James, and thank you, of course, to Pak Dewa. Those are really, really very helpful and comprehensive comments. Yes, I did. We did notice the urban bias in the IFLS, and I think that's really important to have urban and rural disaggregations for Indonesia. Even the consumption poverty measure is different. So we have Indonesia has a rural poverty line and a different poverty line with different food items and different non-food items that are included within the poverty line for urban areas. So yes, thank you so much, Pak Dewa, for reminding that, and your comments on the different types of indicators that can be included in the IFLS were also really really helpful for me, someone who's just trying to understand the data set. It's so rich. At OPHI, Sabina keeps teaching me to do something called the universe of indicators, which is the different types of indicators we can formulate using the data set that we have. And for the IFLS, since the questionnaires, like one module could be like 300 pages, the universe of indicators that I was going through for the IFLS took ages and ages. But yeah, it's such a rich data set. I feel like I want to test every indicator and look and examine at every indicator. But yeah, your comments on anthropomorphic measures were also really helpful regards to using the different sort of median average or weighted average measures, and then comments on the looking at what factors actually affect people moving from being poor to non-poor or extreme poor to poor, Pak Teguh and I were discussing the potential of using I don't know, some sort of regression framework to figure out what the characteristics of the households were and what sort of pushed them. And of course, looking at the indicated contributions across the years would be a next sort of first step with regards to what contributed more to multidimensional poverty over the years, and then possibly doing some sort of regression analysis to figure out what demographics or what household characteristics or what environment characteristics actually contributed to multidimensional poverty or to people switching from one category to the next. And I mean, I guess another thing with the IFLS, it also has a community survey, a community factor survey that was asked of community leaders. So in Indonesia at the village level, we have like village heads. So 2 village heads were asked about community level facilities. So it's just, I guess the potential that you can do with this huge data set is limitless. But I guess it's also a challenge for a researcher to sort of stop what to do to kind of like hold it in a little bit, maybe. But Dewa, those are really very helpful comments. I mean, they've also sort of like inspired me to work more quickly with regards to churning out more detailed results, and hopefully we can discuss them further. So I guess over to James and Jacob and everyone else, if you have any comments, that would be really helpful.
Fair enough. I'll turn it over to Jacob in just one second, but I do share the curiosity, if not amazement, at 63% chronic poverty. When I first wrote on that topic, I never would have imagined that higher percentage would have all periods in poverty in data set from Indonesia. So I'd be kind of curious to see what the heck is going on there. Yeah. Jacob, go ahead and ask some questions from your audience.
Thank you, Putu, Dr. Wisana, James. I think we have a couple of questions probably here, and I might add with her.
Hi, thank you, Putu, and also the discussant for a very interesting presentation. Thank you. I just had, I suppose, one sort of question and a comment. The question's kind of been covered, in what you've just said, to an extent in terms of, maybe doing some regression analysis to see what some of the characteristics are that might have led to some of the, the changes in poverty and so on. I suppose even just descriptively, I mean, the MPI is, of course, a decomposable measure. So even, decomposing it into subgroups for each of the years and, seeing whether there are greater contributions in certain years to people with different sorts of characteristics might be interesting. I suppose somewhat related to that, and again, it sort of came up, I think, earlier in the talk, but I suppose this question of how the representativeness of the data may have changed over time. So again, if we were looking at changes in poverty in different subgroups, it might, just to perhaps look at the percentages of those different subgroups from wave to wave and how they might have changed to help interpret that. There was just, the only other one was more of a sort of a comment. I mean, I suppose the headline, one of the headline bits of good news is the extreme poverty has gone down, and but one of the caveats being that the poor section has gone up. I suppose, I just wonder again, is that actually good news in disguise, in that it's not a real increase in the poor group, but it really is people that have improved in going from extreme poverty to just poverty, and in which case it might also be interesting to look at which dimensions have really driven that, and whether there's further mileage in improving that dimension, let's say, to get people below poor, or whether then it's time to start looking at other dimensions. Thank you.
If I may add just a couple of questions myself, since I have the power here of the local chair in Oxford. Thank you so much, Putu. I'm sure this is going to be a fantastic contribution to all the discussions that are happening in Indonesia around multidimensional poverty as well. So yeah, I think it's fantastic. As someone who doesn't know the Indonesian context very well, I just had some very, I guess, silly questions on, first of all, the structure. So I was wondering if you could tell us a bit more about two of the indicators in particular. One was the sewage indicator. And I'm sure you've thought about this and looked at how the other indicators are distributed. I would have thought, well, that's probably more or less the same as having sanitation or not having sanitation, but it might be that sewage is, you know, a completely different thing in the Indonesian context, or certain policies are associated with it. So I was just curious to learn more about that. And then the second one, the health indicator that you split for the children and the adults. I was just curious if you could tell us a bit more about the motivation of doing that. Particularly, I thought in a context of having a panel of more than 2 decades, where, you know, also at the household level, of course, what you observe is that some children at some point will just graduate from that age cohort, which will then register perhaps as a, you know, a reduced deprivation, but in fact, they might still have the same deprivation, just that they're adults now. So I guess, especially in such a longitudinal context, some of these indicator definitions become very, very intricate. Yeah, that's it from me. I see we also have a few questions in the chat box.
So why don't we let Putu, you go ahead and answer the first series, and when you're done, I'll look at the chat box.
Thank you to the first comment, Jacob. What was your name? Thank you so much. Those were really helpful. I guess
I'm Larry Rupp, but people call me Larry.
Thank you so much. Those were really helpful. I've taken a lot of notes, and I don't. I think yes, I agree with you that descriptive, like even just having a descriptive analysis of looking at which indicators contributed the most to multidimensional poverty across the years and looking at how that sort of changed it would be very interesting. And then yes, representativeness of the data, yes. We should note and caveat that because as Pak Dewa said, the IFLS survey they followed each of the households, even if they moved, and they followed like the split households too. So definitely like the composition of where they live and everything changed changes across the years, particularly across the 20 years. And then looking at which dimension or which indicator drove sort of decreases in extreme poverty. That's also interesting. We have a lot of things in my head now. And Jacob, thank you so much for your comments. Yes, looking at the different types of indicators across the different waves, I guess currently for this very, very preliminary, and I think probably biased measure, we were just looking at what measures of living standards, I guess what measures of health were consistently sort of measured across the 5 waves. But you have a very good point with regards to splitting the health indicator. So between child and adult poverty, I think Pak Teguh had some sort of reasoning behind this, but I also technically I guess agree with you, because you know children in 93 will become adults in I guess the subsequent years, and that would affect sort of children graduating from being deprived in that indicator and that. So of course these considerations, I will bring these back to the team, and then hopefully we'll be able to sort of analyze more indicators, and then do robustness checks with the indicators, or do further redundancy analysis and sensitivity analyses with the indicators to finally create a more sort of robust measure. And also that's a good point, because we're looking at dynamic poverty and not just static poverty. That kind of that sort of I guess framework of thinking also needs to sort of I guess permeate all these decisions behind the indicator selection. So thank you Jacob, and we've got a lot of questions in the chat, which is
yes, you can read them, but I'll read them. First,
okay.
From Juliana Yael Milovic Finkelstein. Dear Putu, warm greetings and congratulations on your fantastic work on measuring multidimensional poverty in Indonesia. I'd like to share 3 questions. 1, why the national MPI structure tries to follow the global MPI. Does this characterize well poverty in Indonesia? I see Indonesia is composed of several islands. Is access to transport between islands important and something that could potentially characterize poverty in Indonesia, or maybe more in rural areas? 2, it would be very interesting to understand which group of population is the 20% that left poverty and which is the 63% that is chronically poor. Are there children or people living with disabilities or female-headed households or any other? Also, any region in particular. 3, from a policy perspective, it'd be interesting to understand which have been the actions that contributed to make the 20% leave poverty, for instance. Learn what worked and maybe what worked less in order to understand where efforts could be placed in the way forward. And then from Sandhya Iyer, we have when we find that chronic MPI has become structural, can we look at the dimensions that have stagnated more as compared to the others? And continuing on, was the dynamism seen in the MPI when we place it across social stratification and climate change related vulnerabilities? Those are definitely great questions. Over to you, Putu.
Thank you so much, James, for reading them out for me. And thank you, of course, to Huli and Sadia for the really great questions. Huli, thank you so much. The first question is very logical. Why follow the global MPI indicators? I guess our aim, of course, in this very preliminary version of the paper is to follow an index that's already tried and tested, which is the global MPI. We're trying to replicate it with the IFLS data and look at the factors that are in the global MPI. But at the end of the day, the indicators that are in the IFLS don't actually allow us to 100% replicate the global MPI. So that's I guess a good comment from Huli. But if we were to make a national MPI or to estimate a national MPI, I feel like it should probably be based by with some sort of dialogue with policymakers with regards to the different indicators that should be included within it. But that's a good comment. So access to transport between islands, yes, it's well, let's see. Indonesia is yes, is an archipelago, loads of different islands, and transport between islands is I guess important. It was one of the campaigns of President Jokowi, which is to create something called a sea toll road. So he promised to to increase all the ports so people could travel by sea, basically. So that is an issue in Indonesia. I'm not really sure whether we can probably measure it in the IFLS or I think we can, because there's migration data in it. And then the second question, yes, definitely, it would be very interesting to understand who basically are the 20% that left poverty and who are those who didn't leave poverty. So and the IFLS data set has data on people with disabilities, very, very detailed data on that. So that's another sort of potential health aspect we could look at, whether people with disabilities experience multidimensional poverty in more intense ways. And then, yes, looking at the different regions would, of course, be very, very interesting. Currently, the IFLS only covers 13 provinces, and Pak Dewa added that the IFLS has a booster data set, IFLS East, that covers Eastern Indonesia. So that would be also interesting to incorporate IFLS East, because there's traditionally been a lot of inequality between Western Indonesia, so Java and Sumatra, and Eastern Indonesia, so Maluku and Papua. So it'd be interesting whether that sort of inequality also exists if we use the MPI versus consumption poverty. So from a policy perspective, it would be, of course, very interesting to see which actions contributed to people graduating from being in poverty. We have another paper coming up, and we're aiming to look at the effect of district level spending on different sectors on MPI, but we're using national socioeconomic data for that, for more updated data from 2022, so 2019, 2022, but that would be very interesting, of course. And then I don't know whether those comments answered your questions, Julio. They probably didn't, but thank you all the same. Sandhya,
take another minute for the other two.
Yep. Can we look at the dimensions that have stagnated more? Of course. Yes, that's a really great idea. And then was the dynamism seen in the MPI when we place it across socials? What's the dynamism? So across social stratifications, that's also a really great idea with regard to looking at different sort of demographic characteristics to disaggregate the measure across time. So that's a great idea. And then climate change related vulnerabilities. So the IFLS has environment data that is also collected within the data set. Honestly, I haven't really looked at that data, but you have given me a lot of ideas. So thank you so much, Juli and Sandhya.
Well, great. I think that likely brings us to the end of today's event. Jacob, would you agree with that?
I'm afraid, yes. I mean, I think we could keep going for another hour, but we probably have to end it more or less here.
Absolutely. So I want to have a big thanks to Putu for all of her good work in assembling this masterpiece of data first time around. And of course to Dewa, who has been so kind to spend time helping us understand the data set and also to work through some of the details. And of course, Jacob, as always, in Oxford, and me in London. Hope to see you next week here on the MPI seminar. Until next week, take care. Bye-bye. It was great to see you.
Thank you, everyone.
Thank you, everyone.